Hello, everyone. Thank you for the introduction, and thank you for the opportunity to present our results on the association of brain-derived neurotrophic factor and cognitive decline in patients diagnosed with mild cognitive impairment and Alzheimer's disease. So Alzheimer's disease is the most common type of dementia, and it is progressive neurodegenerative disease that is associated with cognitive decline and memory impairment. The main pathological changes that are characteristic for Alzheimer's disease is the presence of extracellular amyloid oligomers and intracellular neurofibrillary tangles that are composed of tau protein. The main cause of Alzheimer's disease is still unknown, but there are certain risk factors that are associated with its development, and some of them are the aging and sex, genetic predisposition, lifestyle and environmental factors, depression, and the presence of mild cognitive impairment, or MCI. MCI is considered as a transitional stage between normal aging and the earliest clinical features of dementia due to its association of increased risk for development of AD. Brain-derived neurotrophic factor, or BDNF, belongs to the family of neurotrophic proteins, and it is important for normal development of central and peripheral nervous system. And also it is expressed throughout the brain, especially in the regions that are important for memory, learning, and cognitive function, such as hippocampus and cortex. BDNF also is important for development survival of neurons, and also modulates neurotransmission, synaptic growth, and regulates synaptic plasticity. Many research show that reduced expression of BDNF is associated with amyloid beta accumulation, tau phosphorylation, neuronal apoptosis, and neuroinflammation. So because of all of these reasons, it is considered that BDNF could be potential diagnostic biomarker and therapeutic target for AD. So to elucidate the role of BDNF in MCI and AD, the aim of our study was to compare BDNF plasma levels between MCI and AD group, and also investigate the association between cognitive decline and the plasma BDNF levels in both of these groups. So our study included 504 patients, where 295 were diagnosed with AD and 209 were diagnosed with MCI. All of our patients were recruited in University Hospital and University Psychiatric Hospital Vrapče in Zagreb, and diagnosis was based on DSM-5 criteria and the criteria of the National Institute of Neurological and Communication Disorders and Stroke. The cognitive symptoms were evaluated using mini-mental state examination and clock drawing test. The blood was collected and the plasma was isolated through steps of centrifugation, and then we used commercial kit of ELISA for measurement of BDNF concentration. So our results showed that our patients with AD were significantly older than the patients with MCI, and also they had lower MMSE scores and CDT scores than the patients than the subjects with MCI. In our previous study, we observed a trend toward higher concentration of BDNF in patients with AD when compared to the ones with MCI. But that was conducted on a much smaller group size. So in our study, in this current study, we had much larger group of patients, and we observed similar trend where you can see that there is significantly higher BDNF plasma concentration in AD patients in comparison to the subjects with MCI. And then we also observed, although weak but negative correlation between BDNF concentration and both MMSE scores and CDT scores. So in order to confirm this correlation, we divided both of our group of patients into categories. So according to MMSE, we divided them in 4 categories where we can see, so this one was the patients with normal cognition. These were the patients with mild, moderate, and severe symptoms of dementia. And according to CDT, we had 2 groups of patients, the ones with normal cognition and the ones with cognitive disturbances. And when we look at MMSE score, you can see that BDNF plasma concentrations was significantly higher in the patients with mild and moderate symptoms of dementia in comparison to the ones with normal cognition. And also there is increase in this group of patients, but this was not statistically significant. I need to note that, I need to point out that this group of patients was very small. We only had 12 patients in this group, which is in comparison to the other 3 groups where we had around 100 in each. Is very small, so this increase is not really clear. But also on the CDT, we observed that there is a higher concentration of plasma, BDNF plasma, in the ones with the present cognitive impairment in comparison with the ones with normal cognition. Nevertheless, several studies also reported that BDNF concentration differs in different stages of Alzheimer's, because it is believed that this increase in BDNF in the early stages of Alzheimer's disease could be due to activation of compensatory repair mechanisms, because it is believed that BDNF plays a role in amyloid beta degradation and has a neuroprotective effect on its accumulation. So as the disease progresses and symptoms become more severe, which is indicated by low MMSE scores, these compensatory repair mechanisms begin to fail, and then it is indicated by low BDNF levels in periphery. So to conclude, we observed elevated plasma BDNF concentrations in AD patients in comparison with MCI subjects, and also negative correlation between cognitive decline and plasma BDNF levels, and higher BDNF concentrations in patients with more pronounced cognitive decline in the combined group of patients with MCI and AD, which might suggest a possible compensatory repair mechanism causing the upregulation of BDNF expression in order to counteract the early and middle stages of neurodegeneration. And thank you for your attention.